The International Association for Muscle Glycogen Storage Disease is a non-profit organization that was founded by patients for patients. My name is Stacey Reason, and I am one of the founding directors of IamGSD, and I also have McArdle's, which is GSD 5. IamGSD has a number of objectives which guide the work that we do. The first, of course, is to raise awareness of muscle GSDs amongst not only the medical professional, but schools where children with muscle GSDs attend and sport clubs and other relevant groups as well. We also aim to provide support, again, not only to patients and families, but also to organizations such as national GSD organizations and medical professionals. IamGSD advocates the patient viewpoint and needs to relevant organizations because they are the ones who best understand their disorder. IamGSD disseminates standards of practice such as the clinical practice guidelines for GSD 5 and 7 that were published last year. We contribute to the planning of research projects, and we do that by helping researchers develop their research plan so that outcome measures are relevant to patients. We also facilitate communications between organizations, especially on an international level, and we work to reduce the average age of diagnosis to age 10 or less. In order to achieve these objectives, IamGSD has established 6 key campaigns. And I won't go through each of them now because I'm going to go through each of those one by one and tell you a little bit more about each of those campaigns. The first, of course, is to reduce the age of diagnosis. As many of you probably know, individuals with muscle GSDs are often not diagnosed until the 3rd or 4th decade of life. So the goal, of course, for this campaign is to have every child diagnosed before the age of 10. And in order to achieve this goal, again, we aim to lean on our objectives and raise awareness about muscle GSDs. And we might do that particularly with physical education teachers because we do hear from patients that many of them struggled during gym class. We will also help to educate general practitioners, and then you can see down on number 4, pediatricians as well, because they are the most likely clinicians to see this patient group most regularly. And then lastly, to make more and parent-centered information available. The next campaign, of course, is to help patients to better understand how to live with a muscle GSD. The goal, of course, for this campaign is to help educate those who have been diagnosed with a muscle GSD soon after receiving a diagnosis. And so, again, we use a variety of different strategies to help achieve this goal. We have a number of patient-facing education material, pamphlets and booklets. We maintain a up-to-date website with a variety of different information. We have a few different social media accounts that cover a variety of different muscle GSDs, so patients can post questions where we can share current up-to-date information such as conferences. We have a number of videos that we have produced on our YouTube channel, which are available also through our website. We run practical courses on an annual basis. Most frequently, those are occurring in the UK, but they have been held in other countries, such as Germany and the US. And then lastly, we do speak at different conferences and workshops to help further educate clinicians and patients. Our next campaign is to encourage regular physical activity. The goal here, of course, is to raise awareness and provide support to patients and their families, as well as clinicians, regarding the importance of regular physical activity. And the World Health Organization outlines that to be about 150 minutes per week. And so in order to achieve this goal, it's important that we share current research, as there are papers coming out on an annual basis that discuss the benefits of physical activity for those who have a muscle GSD. And because this is a very difficult concept, a disorder that actually can become worse with physical activity, yet can also be improved with regular exercise. And so we provide practical resources that offer guidance on how to safely exercise. We also support clinicians who care for those patients and provide them with resources and guidance. And throughout the year, we often offer opportunities to get moving, where patients can come together and be supported by other patients. And then lastly, we provide funding to researchers who are doing work in this area. Promoting clinical practice guidelines is another campaign. And I'm just going to take a step back for a moment to highlight the issues. So many patients, as I've already mentioned, experience a delay between symptoms and diagnosis. And that often can be a 30-year delay. And then, of course, once patients do receive a diagnosis and are very happy to finally understand why, often don't receive proper guidance on how to manage because there just aren't enough clinicians. We have to remember this is a rare disorder, and so we can't expect all doctors to know everything there is about all rare diseases. But unfortunately, without access to proper clinical care, patients don't learn appropriate day-to-day management or how to manage an episode of rhabdomyolysis should that occur. And so combined, not knowing how to manage or how to respond in an emergency can of course negatively impact patients both physically and psychologically. And then lastly, again, as I touched on, this is a rare disease. Muscle GSDs are all considered to be rare disorders, and so we cannot expect all clinicians to understand the nuances of these disorders. And so the goal of developing clinical practice guidelines for GSD 5 and 7 was for it to be not only a source of information, but also a practical resource tool for patients and clinicians so that they can address the issues that I have highlighted previously. In December of 2021, we did publish the clinical practice guidelines for GSD 5 and 7 in the journal Neuromuscular Disorders. The next campaign, improving access to care. So the goal here, of course, is to ensure that all patients with a muscle GSD have access to expert care so that they can improve their quality of life. So again, in order to achieve that goal, we aim to raise awareness, because the more people are talking about it, the more people get diagnosed and the greater their need is for more centers of care. Leading the production of not only CPGs for GSD 5 and 7, which have already been done, but for the other muscle GSDs as well. We do hope to promote the establishment of a center of expertise or a center of excellence. This would be a center that perhaps in a large country such as the United States, you could have a number of centers of expertise. Perhaps there are already centers that are existing that could become or considered to be expert centers for muscle GSDs, and then clinicians that are in smaller communities further away will be able to tap into the excellent at those centers of expertise. Promoting the use of multidisciplinary teams to support patients is another important avenue. We have seen at the clinic in the UK, under the guidance of Dr. Ros Quinlivan, that they have not only the specialist care, but they also have a dietitian, they have a physiotherapist, they have a psychologist, so that you can address all of the needs that the patient might be experiencing. IamGSD also offers, as I've mentioned, online and print resources, which are very helpful when you don't have access perhaps to your clinician, or it's in between visits. You can refer to the print material. And then, of course, maintaining an online directory of clinicians, which we have available on our website, so patients can see if there is an expert clinician close to where they live. And then our last campaign is contributing to research. In order to achieve this particular goal, we collaborate with researchers on a number of different projects. We do promote patient involvement in registries, because that is one way to both gain information and insight into the patient experience, because there are usually a number of questions involved in patient registries, but it also is an ongoing database of patients that might be interested in participating in research projects. IamGSD participates in research committees. We disseminate information to patients, and then, as I mentioned earlier, we also take that information back to researchers. So it's a nice loop of information flowing both ways. And then lastly, we do provide funding to researchers who are doing work in areas that support our objectives. At any time, if you'd like to learn more about the work that we are doing at IamGSD, please do visit our website at IamGSD.org. Thank you.